Okay. Hey, this is J.R. McNair, Small Business Network. We're bringing some more COVID-19 news to you all, specifically for small businesses, talking about a lot of the small business relief efforts. And, we've had on CPAs, consultants, the sort, speaking in general of just the relief efforts and how they affect small businesses. But I wanted to actually bring on a doctor, someone in the medical profession, to speak on just the actual surrounding issues around the actual virus, and to actually understand. And I have a great friend of mine on, Dr. Stephen Bailey, and he has come on to inform us just about what this is, how it affects us, how you can prepare for it, and the sort. So thank you so much, Dr. Bailey, for coming on. How are you?
I'm doing fantastic. Thanks for having me, JR. With the COVID-19 crisis and pandemic, there's been such an atmosphere of fear and uncertainty. And I think, we should do the best that we can to educate ourselves so that we can live in an atmosphere of facts as opposed to fear. I think there's so much going around, and we just have to read and understand and actually talk with people who are experts or knowledgeable in the field, as opposed to kind of just getting little bits here and there.
Yeah, I think that's so important, and that's so important. And when we talk about the facts, just give us the facts. Just, I know everybody knows what heard of COVID-19, and they know it's something that can affect us in a contagious way. But can you just give us some actual history and just some actual facts on what it actually is?
Yeah, so we'll give some context. So first, coronavirus, most people are knowledgeable of that term, but COVID-19 is actually breaks down that coronavirus into specific terms to help classify it. So the CO at the beginning of the COVID stands for corona, and the VI stands for virus, and the D stands for disease. So that's where we get COVID from. 19 is when it was discovered, so 2019 are their first documented cases. So to give you an idea generally about viruses, viruses are non-living submicroscopic particles or infectious agents, actually, that consist of nucleic acid, which is either RNA or DNA, and then it also consists of a cell capsule or an envelope that houses that genetic material. So viruses, all of them have this similar setup, and their ultimate goal is to get inside the cell and use the cell's material to replicate itself. It's called progeny. So it makes a copy of itself so that it can infiltrate more cells. So that's the goal of viruses. Some viruses affect animals. Some affect humans. There are very few that go interspecies between, like animals and humans. And when they do, they typically cause massive problems because our immune system just has not been used to that type of virus before.
Wow, that's amazing. And so, so when they you talked about how viruses infect people, but and specifically how the coronavirus spread, but could you get a little bit more in detail on how it actually spread and how that actually happened?
So I'll give you a little bit more detail about how it actually also infects people as well. So when we look at the coronavirus, the cell membrane or the cell envelope or the viral envelope, if it were, when you look at it, it has some proteins on it. They call them spike proteins, and these proteins actually have adhesion molecules that when they join and find their specific receptor, which is the ACE2 receptor for the COVID-19 virus, they bind. This binding allows the cell membrane and the virus envelope to fuse, and they fuse and allow the genetic material that's inside the virus to then insert itself inside the cell. And that's where the real damage happens, because then that genetic material, the RNA specifically for this virus, is something that your cell can read. So the cell sees this material and says, oh, this is code that I need to manufacture something. But the body doesn't know that it's manufacturing the virus and not manufacturing just typical things that you need to use in your body, like hormones or proteins or what have you. So before it's too late, or before the cell recognizes it, it's generated thousands of copies of this virus, and then that virus will cause a cell to break down so that it can get out and do the same thing over to other cells. So one of the things that we look at with coronavirus is really, how does this virus spread? And the viral spread for COVID-19 has been documented as being droplet spread. However, one of the things that I think may have initially caused the spread to be so rapid is that it can also be spread from contaminated surfaces and is partially somewhat airborne. And what I mean by that, the droplets, like when you cough or you sneeze, you have your saliva or mucus that encapsulates these viral particles. So they're not exposed to the outside environment until they either dry out or they come into contact with something that makes them non-viable or causes their nucleic acid type material to decompose. So with droplet spread, most of that is contained by either having people wear a mask or having you protect yourself by not inhaling those droplets. So that's where that N95 mask comes in. It blocks out 95% of the particles that would be in the air. So it helps block some of that viral inhalation into the lungs. But on contaminated surfaces, if that virus is alive, which is showing now that it can be alive on the surfaces for several days, if you then touch that contaminated surface and wipe somewhere in your T-zone, your eyes, your nose, your mouth, or you eat without washing your hands, etc., you can get contaminated. There's been some evidence of even fecal oral contamination. So, for example, if you get COVID-19 and that virus is being shed in your stool, and you go to the bathroom, but you don't wash your hands or you don't wash your hands properly, then you spread that virus along to another contaminated surface.
Hmm.
So that's what a lot of the recommendations now are being built around, the way that this virus spreads to try to protect you.
So when we talk about, so I have a couple questions. We say in 95, so that 5%, can the virus scoot through that 5%?
It's less likely, because
Okay.
when we're talking about the way that it's transformed, it's not, or being transferred, it's not the individual virus that we're trying to block out. It's the virus inside of a droplet. So
I
those
got
droplets are typically big enough to be caught and blocked by the mask, but the virus itself is much smaller than the pores on the mask.
Okay, okay. And so can this be transferred in drinking water?
No, so actually, that's one of the great things, like the way our drinking water is processed.
Mhm.
All of those things will actually kill viruses, and that's one of the good things about being in a place where the water is treated. I know that doesn't sound really too comforting for the people in Flint that got lead in their water, but
Yeah,
that's a
yeah.
contamination via the pipes as opposed to the actual processing of the drinking water.
Yeah, okay. That makes total sense. And so, when we talked about, it can survive on surfaces, who is susceptible, to infection when we talk about, I would say, most vulnerable when it
Yeah.
comes to the populations.
So when we talk about susceptibility, I think anyone who has not had this virus can get COVID-19. And the good thing about when you look at the spec sheet on this virus, it the majority of people, about 80% or more, will have very mild symptoms. It's possible that there's some people who would have COVID-19, their symptoms are so mild that they may not even realize that they're sick. So the other thing about this process is that the vulnerable people are the people who are vulnerable in almost every other statistic that you look at in terms of health. So those patients who are elderly, because their immune system may not be up for that type of challenge or insult. You have diabetics, people who have pulmonary or cardiac issues, just because the stress of having a severe infection, they may not be able to tolerate that stress from the infection. Um, Additionally, children or people who are immune compromised. So in the United States, that could be a very broad group, because all those people who have either rheumatoid arthritis or lupus or HIV or AIDS, things like that, their immune system is already compromised. So taking another insult just makes it problematic, because their immune system is not going to be able to respond the same way that a regular person with an intact, boosted immune system would respond.
And so if we're talking about, so you said some people wouldn't even be able to notice if they were, they had it, because they wouldn't be sick and they wouldn't even know either way. But what will the symptoms look like for those that, because we're in the middle of flu season, and people will get sick from other things all the time.
Yeah.
So how could they differentiate between this and something else?
So their illness will be much like the flu, and the symptoms are usually fever. They'll have a cough. Even now, there are reports of people having headache as well as GI symptoms, whether that's diarrhea or nausea and vomiting. There was a report that was published in one of the infectious disease journals for this month, that they have had 2 cases of patients presenting with encephalopathy due to meningitis due to COVID-19. And essentially what that means, that's a brain infection or infection that's inside the central nervous system. So it was actually very interesting that these patients did not test positive on their nasal swab, but they did have a positive test when they tested the fluid that was around their central nervous system.
Wow, that
Yeah.
is something. And so they're I see that they're kind of finding out information, like new information on this that, just only, weeks before they didn't have.
And I think that's one of the things that's so frustrating for Americans typically, because we usually are able to find out information on demand. We're so
Yes.
connected with the internet and with books and with the latest reports. But the thing that most people don't understand, the majority of the information that you'll find out about an epidemic is after it's over.
Yeah.
So we're still in the throes of it, and we're trying to get a handle on it to become expert level. And we've only had 3 or 4 months to work on it. So I think a lot of Americans are seeing the growing pains that come with trying to learn something on the spot.
And so you spoke about testing. I mean, how are people tested, and what are the current treatments, and
Yeah.
for COVID?
So in terms of testing, most people can be tested if you're having symptoms and really having respiratory distress. Usually, you'll be tested in the hospital, and they'll do that test there. If you have symptoms and you're in an at-risk category, so like we talked about, the immune compromised, elderly, or people with diabetes, heart, lung issues, you can actually be tested by going online to your Department of Public Health.
Okay.
And each state is administering it differently. So in the state of Georgia, you fill out a questionnaire, and if you have the correct information or the categories that they're looking for, then they will schedule you to come in and be tested. Right now, they're saying if you have symptoms, but you are, and symptoms being like a cough or a fever, but you're still managing well, meaning that you're breathing without difficulty, et cetera, then usually they recommend that you can get you can actually just stay at home. And if your symptoms kind of deteriorate, then you should call and come into the hospital. One of the things that we really don't want people to do is that if you feel sick and you have those symptoms, we don't want you to go into your regular doctor's office because you could contaminate people without being aware.
Most and so a lot of people, this anxiety can make people, especially people having anxiety attacks, make people not breathe
Yeah.
or not be able to breathe. And so it's like, I can't breathe, but is it COVID, or is it just me having anxiety?
Yeah. And one of the other things about testing too, right now we're doing nasal swabs and they're trying to transition to blood testing. The way that viral testing is done, which is, I think a lot of the public doesn't necessarily have an idea about it. It's not like testing for bacteria where you can see them grow in a culture and kind of get an idea of what they're sensitive to, or you can even look and see them under the microscope. Remember, these are submicroscopic um, entities. So the way that they test them is through indirect testing. So one of the testing mechanisms they use is PCR, and it's called polymerase chain reaction. And what it does is it takes that RNA and it binds it with some other genetic material, and it tries to amplify it. So it makes several copies, and the more copies it makes, the more easily it is detected. So what they're looking for is the RNA, or the sequence of nucleic acids that are related specifically to COVID-19. And if they can get that sequence to amplify in the specimen, then they know that that's what it is. That tells you that the virus is present. It doesn't tell you if it is in a mode where it's active, where it can infect people. So the second mechanism that they're trying to move to in testing is actually looking for um, antibodies. So antibody testing, and I'll just give you the short of it because I don't think many people know about antibodies, but your body develops these antibodies, which are proteins that protect you against things that your body views as foreign. So they have IgM, which is kind of your innate immune system that is non-specific, and it binds things that are um, not identified as self or as identified as part of your body. Then they have an IgG system, which is a more specific system that your body produces proteins that are specific to entities that you've come in contact with in the past. So if you've had pneumonia due to strep, then it will produce an IgG that's related specifically to strep. So anything that you've come in contact with in the past, your body's immune system is so amazing, it can develop immunity by using these proteins.
That's amazing. And so when we talk about the treatments that they currently have, and
Yeah.
then vaccines that they're trying to, I guess, develop. You have people like Bill Gates throwing billions of dollars at things, and everybody else that they're trying to. When are all of these? They're currently doing one thing, but when are they saying that they should have a solution, one way or the other, for some of these other things that they're mentioning?
So I just want to mention, as I say that the primary treatment for any virus is usually supportive. That means your body um, will eventually fight these viruses over time as time goes on. However, during that time period, the medications that are given at reducing either the life cycle of the bacteria, or excuse me, the virus, reducing its ability to attach to that membrane, so it can't fuse and inject its genetic material, or decreasing the replication of the virus. So they have a couple medications that they're using now. One is called Camostat, and that basically inhibits the viral attachment and entry into the cell. There are two others that actually are being tested as well that have a similar mechanism. One is Arbidol, and the other one is hydroxychloroquine, or chloroquine, which has kind of gotten a big kind of position in the news due to President Trump announcing it. But it basically prevents that process of when the virus is fused now to the cell, it prevents the genetic material from being taken inside the cell and moved towards a location where it can be replicated. So those are the three ones that are working with that whole binding and transport phase. And then the antivirals, which are remdesivir and ribavirin and some other antivirals, are really focused at inhibiting the RNA translation. Or what that means is changing that genetic material, which is on your RNA, into a protein that can generate a new virus.
And when you say RNA versus DNA, how does that vary?
So they're all ribonucleic acids, but the DNA is double-stranded, and RNA can typically be single-stranded. So the RNA will match to another area of nucleic acid, and that actually will form um, a code that your transcriptases, or the proteins that make new RNA strands, can read. So it's a little bit of a complicated process, but you
Yeah.
can see that one, when I think about this, you realize how wonderfully your body is
I
made.
was just about to say that. I was like, man, this sounds like a supercomputer, you
Yeah,
know,
and I think
making it building code, and it's so
that's why
amazing, really.
they use the term virus for like infecting computers and stuff, because it's a similar process. It's just malicious code that your body accepts without really proofreading it. But then when you look at your immune system has several ways that that you can attack these invaders and remove them from your system. And I
Mm.
think one of the things that people don't focus on enough during this time period, we know about social distancing, we know about good hygiene and kind of things like that, but we need to be strengthening our immune system. The things that you can do to help strengthen your immune system, really, I mean, you can take vitamin C now. You can take zinc over the counter. It'd be better to get those things in natural foods, because those foods also have some good properties that will help with your overall body health. But if you can't get those things now, get them as a supplement and take them so that your body can use them. Getting fresh air, getting oxygen. Your most systems, in terms of killing viruses and bacteria, your body uses oxygen in the form of hydrogen peroxide to do that killing. So if you are not getting enough oxygen, then it's like having a gun with no bullets.
That's right.
So we need to arm ourselves. Getting outside, getting a good healthy dose of sunshine can increase your vitamin D levels. And vitamin D levels, we've seen now repeatedly that most Americans and most people in this modern age, being indoors, have a very low vitamin D level, and that not only lowers your immune system rate, but it also makes you susceptible to things like diabetes and other things like that. So just simply getting outside and doing some exercise, those things can all help your immune system.
Most definitely, most definitely. And when we talk about going in and looking at, I mean, and I tell you all the time, I say, if you see it on the internet, it must be true, right? So now, I mean, it's just all kind of stuff, that are that people are talking about. One of the things that I wanted to kind of, I guess, just let people understand and know is, the fact of viruses, and are they living, are they dead? That's one of the things I
Yeah,
want you to clarify for the people.
yeah. So viruses are not living. They're basically just microscopic or submicroscopic code that's looking for a host. So essentially, I've heard some people saying, well, if a virus is dead, how is it how is it that it can still infect people? Well, one of the things that we're talking about is these receptors that are on the surface or in the envelope of the virus helps do all of the work that you would say makes a virus alive.
That's right.
They bind just due to um, bonds that are formed by these proteins. It's almost like a magnet. A magnet doesn't have to be alive to function.
That's
You
correct.
just get them in close enough proximity, and they attach. So once that attaching process happens, a lot of the other things are almost like a reflex or a cascade of enzymes that happen on the cell side that draws that virus and the material internally. So I think when we look at it like that, it is not alive, but it is something that can work using your own system. So they have viruses that are killed, and when they mean killed, what they're doing is there are um, in terms of vaccines, they're using proteins that your body can recognize against these viruses, and they're inserting it in a form that does not cause your body to accept it and replicate the virus and go through the whole proliferation of the virus. It just gets your body exposed to those proteins that the virus carries so that when it sees it again, it can attack it.
Okay, that's amazing. And so, and then let's talk about, testing, PCR versus like antibody testing. Can you kind of touch on that some?
Yeah. So PCR testing, and one of the controversies behind it, a lot of people are saying, well, how do you know if you're affected by COVID-19 if they can't see the virus? Well, we test these viruses in a basically indirect manner because they are so small. If you imagine, it's kind of like searching for Waldo in 5 or 6 football fields.
Oh
So you
wow.
can eventually find Waldo, but
Yeah,
how
yeah.
much
It's gonna
time will it take for
take
you
to
to
find
search
them. Yeah,
that size to find him?
yeah.
So what we do in a more efficient manner is look at PCR again, which is polymerase chain reaction and real-time PCR, and that basically takes the genetic material and amplifies the genetic material in that sample, and then you can match it up to see if it matches with the RNA of the virus to make sure that that's what's in your sample. Then
Okay.
the second way is antibody testing, which I think is actually a good way of testing for this, because if you test for the IgG level, it lets you know, one, if the IgG or antibody testing for that specific virus is elevated. It lets you know, one, that that person has already come into contact with that virus. But number two, it could also let you know that that person has now developed some immunity by seeing the type of antibodies that respond.
Okay, that's amazing. And so, and if we talk about, probably the biggest controversy of them all, and that's 5G. Yeah.
Yeah,
Could you kind
yeah,
of touch on that and like, I mean, because I get emails, and of course I have seen, of course, tests and top tests on just, of course, harmful effects of any kind of radiation from cell phones, that were done years ago, just on, traditional raised in things that cell phones would give off. But specifically with the 5G, could you touch on that and really give people some, some perspective so they kind of really understand?
yeah. So this 5G is another really sequence or frequency of electromagnetic waves or radiation. When I say radiation, it's a term that affects anything that has waves. When you look at the radiations, magnetic radiation scale, they have stuff that involves visible light and things that are invisible as well. So when you think about that spectrum of things, you have like AM, FM radio, that 1G, 2G, 3G, 4G, and now 5G. And 5G is not just like a little step up from 4G. It's like exponentially larger. And what that does, it allows you to carry more information to do things like drive autonomous cars and to run security systems and to have everybody on the internet at the same time. Like we all noticing now that everybody's at home and running the internet and running their 4G, that things kind of time out and run slow. If you had that happen while your Google car is driving or your Tesla, you would end up in a ditch.
That's right. That's right.
So what they're doing is they're trying to generate this system. Now, the 5G specifically, I think it's basically millimeter waves and sub-millimeter waves that run at a frequency from 30 gigahertz to about 90 gigahertz. So that's a lot of technical jargon for saying that they're really small cells or waves that are going really fast. And what happens then is that these waves, in terms of the distance that they can carry, they start dropping off at about 100 feet. So as you get around 100 feet away from the source, which is that antenna, it drops off to the point where you can't really carry that signal anymore. So what they're doing now is investing in actually putting up more towers to carry that signal. So to give you an idea of the magnitude of this process, the amount of towers that they have to put up is more than the number of towers that they cell phone towers that they had to put up over the past 3 or 4 decades.
Oh, wow.
So it's to the point where they're saying that you need to have a transmission tower about every 500 feet.
Wow.
Yeah, so they're trying to determine ways to make that unintrusive in your community and not, bring like big towers everywhere. But that's one of the concerns that people have. Number one, it's going to be all over the place. They've had some controversy saying that every place where they've seen an explosion in 5G, they've seen an explosion of COVID-19, starting with the Wuhan province in China. But if people actually look at the details, every place where they have these hotspots is also every place where you have a lot of people. And one thing that you notice about cities and high places that have high population, those are the people who want to have 5G, right?
Yeah.
So it's not necessarily that 5G is causing coronavirus. It's just that the things that make coronavirus spread, high populations, are the same people who are demanding a system that can carry all this information for work or for pleasure or for what have you. So I think when we look at these things, yes, 5G to some respects hasn't been as rigorously tested. I've seen some people saying that 5G can actually the waves can actually penetrate and do damage to your DNA. The wavelengths for the 5G technology can partially penetrate your skin, but they can't go deep to the tissue of your skin and start damaging your organs. They do have deterrent systems that the military uses that uses sub-millimeter waves like this 5G technology, but it's a different frequency. So, and what that does is it causes your skin to feel an intense heat, almost like you were burning. But again, I mentioned that to say that the frequency that is being used by the military is different than the frequency that's being used for 5G. And one of the good things about this type of radiation that's frequency based, you can target that frequency and it lets you do only so much. Like, for example, I did several years of laser research, and laser is basically an acronym for light amplified stimulated electromagnetic radiation. And essentially what that does, you can target it where it can go a millimeter into the skin or half a millimeter or a nanometer. You can basically target how deep you want that thing to go, and it's very precise because the wavelength only gives you so much. So what I'm saying, I'm not the 5G expert, and I can't tell you that 5G is going to be safe and everything, but it's not causing coronavirus. There are some people who worry that the electromagnetic waves and radiation are changing the targeting patterns for birds or bees and how they navigate the system. I'm not an expert on that, and I can't tell you that. But if they're thinking that COVID-19 or 5G is being used as a way to kill people with coronavirus, that's a very bad conspiracy, because that means that the person who developed it can walk by a tower if it's going to be every 500 feet, and then they would also infect themselves with coronavirus. So,
Yeah,
yeah,
that's right. That's right. So cause doesn't necessarily have effect there, right?
exactly.
So yeah, most definitely. And so, I wanted to make sure we kind of got through those things, but now um, we have essential businesses that are people that are currently at work, people that are
Yeah,
working, and also people that, and I heard in May that as early as May, a lot of states are going to start reopening. So how can people keep themselves safe? Like, uh, currently, when there's less of the population, and then when they actually, release larger portions of the population to go back to this new form of normal, how
yeah.
can they protect themselves?
So that is a very good question, and that reminded me that I left out one of the biggest at-risk communities, and that's the African American community. We've seen that this has impacted us in a way that has not reached other ethnicities, and besides, you know, chronic illnesses, a lot of us are essential workers, and we're in the front lines, whether that's in grocery stores or whether it's gas stations, whether it's in the hospital, whether it's in transportation. We are essential workers. So the things that people can do to protect themselves, number one, they should screen people who come into their establishment in terms of making sure that the people, if there's going to be any dwell time at all, that they're not having fevers or that they haven't been in contact with somebody who's ill or positive. Second thing, I think wearing a cloth mask and having other people who are coming into your business wearing a cloth mask. That's not the N95 mask or a surgical mask. All it is basically provides a barrier that if they cough or they sneeze, it's being caught in that material and not being spread in the air. The other thing is that um, careful hand washing and hand hygiene, limiting actual touching. So if you provide a product to somebody, you can put it in a basin where they can pick it up, and you can sanitize that basin between people, and that way you're not actually coming into contact with anything, and your customers also not coming into contact with anything. I think taking those type of provisions, limiting the number of customers that are in your store at the same time. I know that all these things are a hassle right now, but your customers will appreciate that you're taking these precautions to reduce their risk and prevent them from getting ill unnecessarily.
Definitely. So I want to have an opportunity to kind of talk to you about just how long do you feel like we have before we get back to a certain normal?
Wow. So that's the crystal ball question right there. I think it's going to be several months. I think probably within the next couple weeks, so like early May, mid May, they'll start releasing some people back. And I think if people take adequate precautions, that could help us for a while. But obviously, the cure for this is a vaccine or herd immunity. And what herd immunity is that so many people have gotten infected and recovered from this virus that the virus does not have a host that it can live in to replicate itself. So vaccines speed up that process by allowing you to be exposed to that material so your body's immune system can combat it the next time it sees that same protein, without you actually getting, seriously ill. But herd immunity is the actual natural answer and how we recover from this. And the problem with trying to go for herd immunity at this point in time is that we only have so many hospital beds and only so many ventilators. So if we were trying to go out there and get everybody exposed to this, like the moms used to do years ago, if one kid had chicken pox, everybody would go to that house so they could get chicken pox and just be over with. If we did that right now, we would completely overwhelm the healthcare system. So what this social distancing plan is, it doesn't mean that we're never going to see coronavirus again, but we're just reducing it to small portions that your healthcare services can handle over time. So I think ultimately a lot of things won't go completely back to normal until a vaccine is developed. But I think overall, people will be able to start getting back to work and getting the economy moving within the next, kind of 2 months or so. And that just seems like that would be a viable answer, just considering the delay or the latency in people getting infected and showing symptoms and the overall duration of the virus.
Most definitely, and we definitely appreciate you coming on and sharing with us all this great knowledge and information. And I definitely believe that our audience is going to take this, adhere to this, and go forth and be safe, keep themselves safe, keep their family safe, keep others safe. I want to let people know, if you have an opportunity and you'd like to reach out to Dr. Bailey, you can reach out to him at info@Dr., spelled all the way out, Stephen, Steven, Bailey, Bailey, .com, and you can send an email there to him, any questions, and I'll also leave his information in our when we send this out, so you can have it there. But Dr. Bailey, we appreciate it. Appreciate all the work that you're doing out there to keep us safe. And we look forward to having you on soon, hopefully when this passes over.
Yeah. One thing I would like to leave the audience with is just a little quote that I got from Alexander Pope. It says, "A little learning is a dangerous thing. Drink deep or taste not the Pierian spring. The shallow draughts intoxicate the brain, and drinking largely sobers us again." So if you have any questions, you have to search deeply, and you can get in touch with the experts and you can find out the answer. I think, learning a little bit about something causes a lot of controversy and conspiracy theories. And again, we want to live in a world with facts and not fear. So blessings to everyone. Thank you for having me on, JR, and I wish you all the best.
Thank you so much. I like that. Going out, facts over fear, y'all. Let's keep that at the forefront. So thanks once again, Dr. Bailey, and we look forward to talking to you soon.
All right. Thank you. Have a great day.
You too.